We get a lot of questions, both from our members and on social media, about self-care tasks such as brushing teeth, washing hands, bathing, how to help kids who are resistant to any of these things, how to help kids become more independent. And so today we are covering the top 5 questions we get about self-care skills and how to help kids become more independent and not aversive to any of these. Let's get to it. Do you have issues trying to help your child or clients with things like toothbrushing, hand washing, bathing, transitioning from a tub to a shower? These are questions we get all the time for kids with autism and toddlers and preschoolers showing signs of autism. And today we are tackling it with the top 5 questions we get about self-care. I have Kelsey here, who has generated our top questions. And like always, we're just going to cover them one by one, and hopefully we'll be able to teach you something new about how you might be able to have all your self-care activities for your child or clients go better and not be so stressful.
Yeah, so let's jump right in. And with what age and prerequisite skills are needed to focus and teach self-care?
Yeah, so this is a great question. We should be working on self-care skills for any child of any age or developmental level. If you think about like milestones that kids should go through, the self-care checklist developed by Dr. Mark Sundberg is, we focus on that a lot. And his self-care checklists were actually written based on childhood milestones, like the CDC Act Early website has childhood milestones. I've done previous videos on what to do when an 18 months old is not talking, for instance. But by 18 months of age, which is the self-care checklist, beginning part for most of the skills, a child should be trying to help wash their face and not resisting toothbrushing, even trying to help a little bit. And a lot of the self-care checklists, I got permission to include parts of them in my book, Turn Autism Around, because we should not just be focusing on language. We should not just be focusing on reducing problem behaviors. We have to get to the bottom of how to help kids with self-care skills. So the self-care checklist, which we can link in the below, but we also can use the digital assessment that I created. I created a 1-page assessment many years ago. And as of the fall of 2022, I created a digital assessment, a software system where we can, in 10 minutes, have a child, basically figure out if they are delayed or have issues with the grooming topics of eating, like whether they use utensils and that sort of thing, whether they drink out of an open cup and a straw, which is, eating with utensils is definitely a self-care skill. But there's other skills like potty training, which also has some grooming and dressing, like pulling pants up and down, and washing hands, and how much they're helping with washing hands, if they're resisting, if they're able to get independent with washing hands. So we have, eating, grooming, dressing, potty training. We also have sleeping, which isn't really, it's more of a daily activity. So these self-care daily activity skills on my digital assessment, they're all up there for assessment. You get a score in your digital assessment for self-care. You also get scores in language and a score in problem behaviors. But today we're focusing on that, the self-care portion, which is really super important. I mean, these skills can hold you back. I've heard of kids being held back in daycare simply because they won't, drink from an open cup. They won't wash their hands. They won't stand in line with their hands to themselves. Like, it's not all about talking. And no matter how old your kid is or how far along developmentally they are, self-care needs to be focused on.
Yeah, I would agree with everything you said there. And I think so often on our social media and in our group, people talk about, oh, well, my child's nonverbal, or my child, can't do XYZ. Can we actually teach them that skill? And the answer is yes. You might have to teach it differently. You might have to use more supports. You might have to use more prompts. But yes, you can teach them. And yes, you should focus on them. And we go through all that, in our online courses. So it's definitely necessary to focus on self-care. I think you said once in one of your podcasts, you might have been talking to someone about IQ, developmental, and how important self-care is to improving a child's IQ, even more so than maybe even language and comprehension.
Yeah, I didn't realize that. And that's a good point. And I have a whole video on IQs, which we can link in below too. But the IQ, as a psychologist taught me, we had a baseline IQ for my son Lucas, and it was in the 60s, I believe, which is below the threshold of 70. Below that is intellectual disability. But she said, don't work just on language, because if you take a 4 or 5-year-old in for an IQ test, they are going to be looking at, are they potty trained? A 5 or 6-year-old that's not potty trained, even if they have full language, is going to have a lot of, especially if they do a test like the Vineland, which is heavily reliant on self-care skills. And just for, dignity and progression to as inclusive environment, if you have a 5 or 6 or 8-year-old or 12-year-old that's not toilet trained, you won't, it will be difficult to have them included into general education classes. It'll be difficult to get a babysitter or to take them on a plane or to a restaurant or to amusement parks. And it's just, and we have kids with multiple diagnoses where it's, cerebral palsy and autism and maybe toileting isn't feasible for whatever reason. But for the vast majority of kids that have autism or signs of autism as their only physical or, only disability category, it is very feasible and should be a huge focus to have these self-care skills be, a child to become as independent as possible.
Yeah. And so that brings us to our next question, which is, how do we help a child do their grooming skills or their self-care skills on their own?
Yeah, I think eventually on their own would be nice, but don't try to fade yourself out too quickly. I mean, the bigger question would be, how can I pair myself so that, a gentle touch and making it fun and helping them brush their teeth is not aversive? Because a lot of kids in our online courses, the parents report that they don't want to be touched. They don't want to be, and if you think about how kids learn, shoe tying and that sort of thing, it is with gentle prompts and it is with imitation, which kids tend not to be great at with autism. So we spend a lot of our time in our online courses taking like the early learner materials and have it be fun and have it be, filled with reinforcement to have the child tolerate these gentle prompts. We don't want to have a child screaming, holding anybody down. We don't want it to be aversive. And so instead of focusing on how to get my child independent, I would say, how can I become involved and make these self-care activities as reinforcing and fun as possible, at least initially.
Yeah, I would agree with that. And also, what you said about imitation is so important, and how, imitation, we have a full hand washing course or bonus video in our courses where you talk about how to use a visual schedule to help the child through hand washing, but they still need to be able to accept a little bit of prompting. And then we talk about how we fade that prompting back. And also, again, imitation. If you're trying to teach washing hair, which is a very advanced, self-care skill, but if a child can't get their hands up and move their hands or even copy you, you're going to be looking at an uphill battle. So being able to just imitate basic motor movements and do basic motor movements is a big step to start with. And yeah, the hand washing, which I think you also cover in your book, and the steps to that, is helpful as well.
And also the hand washing bonus video, we decided to put that on YouTube as a free bonus for everyone. So we can link that in the show notes and below as well, because during COVID, hand washing became a huge thing, and we decided to give that out. So we do have a link for that below.
Yeah. And so that kind of brings us to our next question, which you did touch on in that answer. My child won't let me brush their teeth. What can I do?
Yeah, we covered this in podcast 185 with Rachel, who is our program director, and her son Everett at the time, I think, was 3. And all of a sudden he became resistant to hand washing. He was speech delayed. He never had an autism diagnosis, and he never received even speech therapy. And now he's completely caught up. But he became resistant to toothbrushing. And so whenever a child is resistant to any activity, self-care, like washing hands, or even to things like haircuts or going to the doctors or getting photos taken where you're not even touching the child, it probably is because there has been an aversive kind of event that happened that, the child, something didn't go well and it wasn't reinforced, and the aversion was actually reinforced. So in Rachel's case, in that podcast, she talks about how they had a babysitter come, and after that, toothbrushing just he got resistant. So instead of being like, oh, what exactly did you do? And what, blaming anybody, it's just like, okay, the whole situation needs to be repaired. So toothbrushing needs to be repaired. When I say repaired, it means you might need to get new toothbrush, new fun activity, new reinforcement, sometimes an electric toothbrush that makes sounds or has a song playing, maybe new toothpaste, maybe you inadvertently switched toothpaste flavors or brands because something was on sale, and maybe that was what triggered the aversion. Go back to gentle prompting, go back to reinforcement, what happens right after the toothbrushing, and go back to gentle prompting, imitation. We have a video on video modeling we can link below as well. All of these techniques can work, but don't feel like, oh, well, he won't brush his teeth. He won't let me help him. I guess he's just going to have to get cavities. No, it's very important that you back up, repair the situation, and make progress to get you back on track.
Yeah. And the one thing I would add to that is we get this question a lot, and people might step back to repair, but then they're still like, well, he has to brush his teeth. So then they're force brushing teeth. And I would actually say, you have two choices. You can force brush teeth for a long period of time, or you can stop brushing teeth and really step back and work on just touching the toothbrush, just gently putting it in with no expectations to repair it back up. And it might be a few days, a week where you don't get a good brush. In the long term, we're going to have happier brushers, lifelong brushers. It's not the end of the world.
Right.
So yeah,
And in doubt, if your child's crying with brushing teeth, you've gone too far. You have to repair, whether that is looking at chapter 13 of Turn Autism Around, which goes into depth about how to repair things and how to desensitize aversive events, or whether you watch or listen to the video I have about desensitization, we can link below, or join our online course and community to get it worked out. Like, you have to do something. You can't just keep going with the child crying, because that holding down, crying, aversive event is going to spill over to all kinds of things. Then when you bring him to the doctor or to the dentist, he has learned that, you know, he's not going to do it by himself. He's just going to scream, and it's going to just it could snowball into more problems.
yeah. And that brings us to our next question. My child wants to keep playing in the sink and the water after hand washing. How can we just get them to wash their hands and move forward?
Well, I would look at what's happening right after hand washing. So if the child wants to go outside and play on the equipment, or even play at the water table outside, even though it's, you know, kind of normally we would wash hands when we would come in from the playground, you know, before we ate a snack, but you can pair, you know, a not so great activity. It's called the pre-mac principle. First you eat your peas and then you get dessert. So he really wants to go outside to play on the equipment. Okay, let's wash our hands. You're going to be much more in a hurry to do the procedure, get it done, so you can get to the next thing. So if it's not paired with something really positive afterwards, there's not going to be any rush. So also look for clues. That's why I said water table. If they like that water play, then get things that you can use away from the sink, like a water table outside, or they even have these new little sinks that you could pair up near the table or in the playroom. You just want to have the hand washing, not, maybe they play in the sink with a timer before or after the, you know, probably after is not a good idea, because now we're going to chain that together. It's already chained together. So we just want to kind of take that out, making something really reinforcing right afterwards. Oh, you're really hungry for this ice cream or this pie I just made. Okay, let's go in, wash your hands quick, and come out. And you may need to go back to more prompting, more video modeling, more imitation, more of a visual schedule, so that it's check, 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 apple pie.
Yeah. And if you don't have something you can give them right after hand washing, some kids, especially with autism, love songs. Could be like, oh, let's finish washing our hands. And as soon as we're done washing our hands, the song starts playing as we start walking away. Or things like that.
Even like, let's play hide and seek. Okay, before we play hide and seek, it doesn't have to cost money. It doesn't have to be food. It doesn't have to be electronics. It could simply be placing the demand to practice washing hands or to wash hands before something really reinforcing.
Yeah. Yeah. And I think that answers that question. And it's great if that is your question, that your child is following the directions and washing their hands. But yeah, we got to get that transition. So that brings us to our last question about bathing and grooming. What can I do to have a successful bath time or shower time? My child hates getting their hair washed, and we're having a hard time keeping them clean. What can I do?
Yeah, so if they hate bath time or are not tolerating it, or are tolerating parts of it, but not the part with the hand hair washing, or you really want to transition them from a bath to a shower. These are all really common. Chapter 13 of Turn Autism Around actually has the story of Michelle C's daughter, who made all kind of progress. Michelle C was on 3 or 4 podcasts now. We can link those in the show notes. But after she got her daughter, Elena, to go from 2 words to 180 words and phrases within 33 days of the online course, which was amazing. That was her first podcast, which is really amazing. She posted in our Facebook group that all of a sudden Elena was screaming for bath time. Like, what should she do? And I got in there, and this was a few years ago, and she joined right when COVID hit. But I said, usually when there's like all of a sudden, she used to love bath time, now she hates it. Like, usually there's something that happened, like being held down in a medical appointment or things like that. And sure enough, a week prior, she was held down for an MRI or some kind of testing that needed to be done medically. So it is what it is. I don't recommend holding kids down unless it's an absolute emergency, where then we have to repair the bath time. So for her, and even if you join our online course and community and have questions, we are not able to like give you exactly what to do for your child, but we can throw out a lot of ideas. Like, do you need new tub toys? Do you need a hose if hair washing is the problem? Do you need a hose with an elephant on it? Do you need a visor to cover the kid's eyes, or a washcloth over their face that they can hold on their face while you pour the water over? Do you need to go all the way back, which Elena did need? She needed to go all the way back to being outside of the tub, fully clothed, with water in the bath, and her playing with these tub toys from outside. Then she needed to get in the tub with no water, play with toys. Then she needed to be in a bathing suit with just a little water. And so we gave her a bunch of ideas. And then a week later, she's like, fixed it. Now she's asking for more tub time. And we were like, okay, what exactly did you do? And literally the step-by-step of the actual procedure for this one child is in chapter 13. But for, another child, for Kelsey's kids, she would have needed different procedures. So whatever method you are learning from me, you need to take all this information and make a plan based on your child. So breaking things down, repairing, making it fun, bringing it all the way back, not forcing a child. If they start crying, you've gone a little too far. You can always regroup. I think we did a podcast with Michelle on the actual desensitization for Elena, so we'll link that in the show notes. It's probably not going to be overnight. It might take a couple days, a couple weeks, but you can repair anything.
Yeah, I would agree. We never had complete bath refusal, but we have gone through phases where neither kid, and both have very different language abilities. Lincoln would be fully conversational, doesn't need a lot of support. Brentley, more moderately affected, has some language, but needs lots of support. Very different kids. And they've both gone through the same, I don't want my hair washed. And the same thing as toothbrushing. One of the worst things you can do is say, well, we just have to get your hair washed. Their hair is not going to fall out if you don't wash it for a week or 2. We can still wash bodies with baby wipes, or, you can still get things clean. So slow down, repair it up. I know Brentley, a big thing we taught him was just the imitation of tilting your head back. And now and then we transferred that to the shower and to being able to tip your head back. And I know, Mary, we talked about transitioning from bath to shower, and that's kind of the same thing. You turn the shower on, and maybe you sit on the other side of the shower and just play with toys. You don't even get in the water. or you practice just with the shower head that comes off and you just spray it around. It's not actually on your head.
Yeah,
And for
or like having them sit in the bathtub, or just putting a little bit of water in. I do think that one of the biggest things when we transitioned Lucas and other kids from a bath to a shower is that handheld. I think having just a regular shower coming down with nobody holding it, no control, is going to be harder than, handheld, where the adults can shoot it to the ground, so it's really not affecting. You can even play little games like, okay, I'm holding the shower head, it's facing down, and then we're gonna, count to 10, and I'm gonna just spray his belly quick, or spray his toes. Let's do your knees. 1, 2, 3, make it fun. And also think about what happens right after a shower, what happens right after bath. It's got to be a super reinforcing activity or reinforcement, and we can also, the beauty of bath time or brushing teeth or washing hands is there is no limit to how much we can practice that. We could practice getting baths, 3 times a day. If needed, we could practice standing on the outside and playing with toys. So this could proceed a lot quicker. The other advice I gave to Cody's mom, Jenna, who's been on the podcast, she was having problems because her and her husband were taking turns giving the baths, and Cody was decompensating for bath time. And so I said, until you get it under control, mom, because I'm here, I'm coaching you. You get it under control, and then you do the bath together until dad can take over and do it in the exact same way. That variability, when a child is not doing well with any activity, it can be a problem too. So I would say, get a captain of the ship to handle it, practice, think reinforcement before, during, and after the procedure, and really just taking it step by step. If you get crying, you've gone a little too far, take a step back.
Yeah, and I think that pretty much wraps up our questions, but I will say that we also do have full self-care units in the intermediate course, so get into our course sequences, because those units about how to teach dressing and how to teach showering beyond, once you have a happy learner, to start teaching is important, but it gets really nitty gritty. And so that's why we can't necessarily cover that in a quick podcast.
And we also have videos in all of our courses. I actually have a very discreet video of showing the procedure for Lucas to independently shower. And I have videos of kids dressing that I'm not able to put on YouTube. I mean, they're totally discreet and everything, but these parents of kids with autism and toddlers without autism have given me permission to show these videos, and it really does involve a lot of time and attention. And I think it's a good idea to focus on self-care. It's at least a third of the pie, self-care, language, and problem behavior. And a lot of times with self-care, we get a lot of problem behaviors if we don't do it right.
Yeah.
All right.
That wraps us up.
Thanks for joining in. I think they were great questions. And if you have any questions, put it below, or you can always email us through our website, marybarbera.com. And I'll see you right here next week.